This is POC Nurse. Let's answer a CCRN question. Question: a patient on mechanical ventilation triggers a high pressure alarm. Which of the following is the most appropriate nursing action? The answers are A. Increase the tidal volume. B. Suction the patient's airway. C. Decrease the inspiratory time. And D. Administer a sedative. And the answer is B. Suction the patient's airway. Rationale of why this answer is correct. Um, Suction the patient's airway. The most common cause of high pressure alarms are secretions or some kind of obstruction in the airway. Now, if we're talking about secretions obstructing the airway, suctioning can relieve this. At the end of this question, we're going to talk about other things that could trigger a high pressure alarm that's not just secretions. Um, the answer A, increase the tidal volume, is also not correct. This would worsen high pressure and risk barotrauma in the patient. Answer C is incorrect as well. Decrease the inspiratory time. It doesn't address obstruction and may worsen the patient's oxygenation status. The answer D, administer a sedative. So, administer a sedative in the context of this question that's requiring suction is incorrect. When you want to administer a sedative, it's because there is some desynchrony or a synchrony between the patient and the ventilator. Due to something, the patient is not being cooperative with the ventilator. In that case, you want to sedate the patient so that the ventilator can do what the provider wants it to do. If the provider wants the ventilator to totally breathe for the patient, and the patient is awake and breathing on their own, which you'd question why they're on the ventilator. But sometimes we have patients that can breathe on their own, but they're still retaining CO2. So you'd have to put them on the ventilator and make sure that the ventilator is able to do what it needs to do to reduce the amount of CO2 that's inside of the patient. So for this question, administering a sedative is incorrect, but it does have its place should the high pressure alarm be due to patient agitation or a synchrony with the ventilator. Um, I said we were going to talk about other causes of high pressure alarms in the ventilator, and some of them are agitation, like we just talked about, coughing, secretions we just mentioned, aspiration, a kinked or occluded ET tube or ventilator circuit. Sometimes having water in the ventilator circuit could trigger these alarms. The water that has condensed in the circuit would have to be drained out into something away from the patient, not in the patient, and then reconnected to the patient. Bronchospasm can also cause trigger a high pressure alarm. In this case, the patient would need respiratory treatments. Decreasing lung compliance, such as in ARDS and a pneumothorax, can all trigger a high pressure alarm. Thanks for watching. Please like, share, subscribe, and follow for more.